All right, let's do it.
Okay, I'm down.
Well, if we can't talk about it here, where can we talk about it? I don't understand.
All right, guys, we're going to get going because I know everybody's time is limited here. So I'm going to do just a quick, has everybody said something? Have I heard, Kara, did you say something?
Yes.
Yes. Fran, you're good?
Yes.
Amber?
Yes.
Andy?
Yes.
Everybody know what we're talking about today?
Yes.
Cool.
Primary
Cool.
care doctor. How to choose your primary care doctor.
All right, here we go. Welcome everybody back to another mid-level show. My name is Ben Rogers. I'm your host today. This is the show where we go over the most recent Dictations podcast by Dr. Tom Rogers. And I'm with the mid-levels of performance medicine. We've got everybody here today, which I'm super excited about. We've got Fran in Johnson City, Kara in Knoxville, Andy in Johnson City, and of course, Amber up in Kingsport. Guys, thank you guys for being here. This week's Dictations was on how to choose a primary care doctor. And I think Dr. Rogers gave a really unique perspective based on his experience as a traditional primary care doctor and now as a more integrative medical doctor in a different type of practice. So let's just go first thoughts here. Amber, I'll start with you. What's your first thoughts on this week's doctor's note on how to choose a primary care doctor?
Well, I thought he did a fabulous job, especially with the alliteration, 4 A's, that you can really stop and consider whether you have a primary care doctor or not. It's actually impacted my household significantly because my husband, we're in our 30s, which you still need a primary care doctor for an annual physical. And that's one thing I wanted to stress today is the importance of having a primary care doctor, prevention, those good follow-ups that you can have. But my husband sees a GI doctor for Crohn's. That's his only illness or, only real medical history. And he doesn't have a PCP. And so this really, or he's had one in the past, but not faithfully followed up. So we have really been searching and hunting and going through these questions, asking ourselves, looking for him. So I think they're great questions to ask.
Kara, why don't you go, since with your experience being in the hospital for a long time, kind of what's your thoughts on Dr. Rogers' take on choosing a primary care doc?
Well, I thought he did make some very good points, as Amber said, but also too, you need to make sure that you and your doctor are on the same page, that you have the same beliefs, that the same ideas about things, that you trust them, and that they're a good resource. Also too, being able to get an appointment. Sometimes you get in with a big practice and you call and you try to make an appointment and you can't get in for a month. And so they're, being available and also having the same views on things, because if not, that can be very tense.
Being on the same page is so critical, it seems. And Fran, do you have something to add to that in terms of, your experience being a patient as well as being a provider? What's your thoughts on a great primary care physician?
I liked what he said about somebody who's going to take care of you and getting you to the right place when you need it. So if you need a specialist, knowing who they are, making the phone call, getting you in if you need to be seen, instead of just saying, oh, well, get yourself an appointment with this guy and maybe they need to be seen quickly. And so I thought that was his best point, is that primary care has to know so much. It's so broad. You have to look at the whole big picture, but then you have to know all the little parts of when they need something more. And the specialists can be very difficult to get into because they're very busy.
Well,
so having he has a relationship with a lot of specialists in town, which I think is very, very helpful.
Mm-hmm. I like that, Fran. Andy, why don't you speak into that? What's your thoughts on choosing a great primary care physician, kind of what Dr. Rogers was talking about this week?
Yeah, I like the 50-50 thing. 50% of what we learn in med school or graduate programs like PA or MP schools are wrong, and 50% of the time, 50% of the time it's wrong, and 50% of the time it's out of date. And that's the thing too, that that performance medicine is unique in that we're well ahead of our time, but I think there are a lot of primary cares physicians and practices out there that are like-minded, and they are ahead of their time as well, knowing that they're going to tell you the most up-to-date and even further than up-to-date what's going in mainstream medicine, so that you're getting the best. I also like it too. It's sticking with one that you like and trust. Amber, when you're talking about your husband, it's like I have the same thing with type 1 diabetes, and keeping up with my eye exams is something I haven't been good at until I found one that I really love. I just went yesterday, and they know my entire history. They're forward thinking. It's a great office, and I feel really comfortable there, and I look forward to going and seeing them every time. They know everybody in my family, even though everybody in my family doesn't go there. And so I don't feel like a number at this office. And I do feel like that is important when choosing a primary care, is that they really do spent time yesterday. Dr. Oglesby, shout out to him. They sat with me and asked me about my life. And that makes me want to keep up with my exams. Everything looked fine, but I was like, sign me up for next year when I need it so that I can stay on task. So I thought this was a really good note, because Amber, you're right. Everyone needs one. Everyone needs one.
Well, and the other thing is, kind of piggybacking on what Fran said, like they're kind of the one that connects you with the people that you need when you need them. And to be on the same page, like Kara was saying, you got to have some similar philosophies, some similar views on your health as well as life in general. It truly is a partnership. And I kind of in the whole thing, I kind of got, okay, it's a great partnership, and it's one that you can't just, go to the person down the street because your buddy goes to them. This is something you really need to take some time with and make a good decision on. Now, I want to ask each of you, and I'll start with Amber, because performance medicine is in a setting that's very similar to primary care in that we get to partner with patients on their health journey. Which of these really connected with you as a provider? Is there any one in particular that you think you really try to bring to the table when you're in a visit with a patient? And Amber, I'll start with you up there. What's your thoughts on that? What's something that you kind of see in yourself when you read that note this week?
That is a great question, Ben. But honestly, it's funny. I hadn't thought about that, but when I looked down at my list that I'd written out, I think, and I've gotten some feedback about this, that I really try to listen to the patient. And I think I would hope that would be kind of a testimony that patients that have seen me would say, but I'm speaking for myself, so better to ask them. But I really do try to listen to the patient. Doesn't mean I'm going to give you, anything you want, but I just want to listen to you, because most of the time the patient's going to know what's going on with them. And so that affability, that part of being human and just listening to the patient and trying to meet.
I love that. I love that. And Kara, what about you in Knoxville? What's your, what's something that you aspire to be, or a strength of yours that you really lean into every single day?
I really try to meet the patient where they're at, find out why they're here, what's their biggest concern, and try to develop a plan with some short-term and long-term goals, and work out a plan together with the patient. What are their expectations? What are their chief complaints? What would they like to see improve? And just work on that. And then we talk about some things we can do short-term and other things we can do long-term. So they have, a reason to return and follow up, and we lose track of them, and they feel that we're interested in them.
I love that. And Fran, what about you? You started a month or two ago here at Performance Medicine. What's been something that you really tried to hone in on?
That there's so many different factors of health. I always like to change one thing at a time so that we know what's working, instead of throwing, 4 or 5 different things all at once.
Yeah.
So, like when you're dealing with fatigue, or, trying to not change too many medications at once, maybe just dealing with one thing at a time and then following up and adding another, but always get things going in a positive direction. Because when you start going in a positive direction, it always just seems to mushroom. And then they start doing better and better and pick up another thing. So discuss a lot of things, but have them focus on one and then look at the other things down the road. Because when you change too many things at once, I find it gets confusing of what's helping and what's not.
I love it. I love it. Andy, what about you?
I try to make sure I stay up to date on my dancing and singing skills in every room that I go into. I try to bring what we call the model look into a room. Sometimes it's with my eyes. Sometimes, it's with just a look or a glance. The ability to try to make people, I try to make people laugh, but it works. I only have a 50% success rate on that. But I think what we all do well, especially sitting here all in this Zoom meeting, is that we are staying up to date on the best stuff. We have a great leader. It's great with Dad being at the helm researching, but we read all of his notes. We talk with him every week, and we are staying up to date on medicine just as he is. And I do find that we are all genuinely curious about the advances in medicine and how we can have this unique spin on holistic and traditional Western medicine. Personally, I just try to bring, I'm kind of with you, Amber. I'd like to come in on a human level and just connect and just say, this is a safe house. You can tell me anything you want in this room. There's nothing that needs to be left unturned. It could help, which is great in our story. And I tell patients that we're like on a circle and there's 1,000 different paths off the circle. And I'm trying to help you find the one that fits you. Kind of like what Fran was talking about. What's that one change we can make so that we know we're along the right path? And once you find that path, it's rewarding for us too, because we genuinely, I don't think anybody that works at this office, no matter what role you're in, from front desk to MA to provider, that we genuinely care. I will tell you that we don't lie about it, and a lot of people can spit that they do, but we genuinely care, and we will continue to dig. And I tell everybody, Dad loves, and performance medicine, I say Dad, but performance medicine in general loves a patient where nothing has ever worked. We will continue to dig to try to find something that will.
Yeah, I love that, Andy, and thank you for saying that. And I can attest, you guys are all here, largely because you have a heart to serve and a real empathy with all of you guys, and you guys have really dug into this type of medicine, and I'm so proud of all of you guys and the way you treat people. But I can, one thing that stood out to me about Dr. Rogers, and he said this about his dad and Andy and I's granddad, is he said, whenever a patient comes in to see you, you got to give them something. You got to give them a solution. And you might not always know right then and there, but they need to leave with a solution. At least they're going somewhere. This kind of like what Fran said. You need to make them feel like they're heading in a direction, whether that's towards just feeling better in general or going to the best specialists in town in this, certain area. I think there's a ton of value in that. And I read the note in a way where, family practice is tough. It's a real tough position for a physician, and as well as nurse practitioners and physicians assistants. So I certainly admire all you guys, and I admire Dr. Rogers. So guys, we're going to close with that. This is going to be a shorter one today because I know everybody's on a time crunch, as am I. But thank you guys for being here. And listeners, thank you for listening. If you haven't listened to this week's Dictations, please do. It's up on our podcast as well as the YouTube channel. That's it for this week, guys. See y'all next time.
Bye-bye.
Thank you. Great job.